this labor has taken a while and that baby feels not small. What do you think? Yeah, she seems a little bit big. So I wanted to have a quick conversation with you about forceps and vacuums. Has your provider talked to you about that in the office at all? No, not so much. Oh, but you learned about it in your birth class. That's awesome. Oh, the online prenatal class for couples. Yeah, people love that class. Okay, so I need you to know that at the very end, your provider might use something called forceps, which is sort of like salad tongs, and they might use something called a vacuum. So if you have questions about those are things to talk with your provider about. There are risks, but I want you to know, because this baby looks a little bit big, that it is something that they sometimes use at the end, just in case you're exhausted or baby is a little bit wonky in your pelvis. They might use them to help baby come out. Okay, you already knew all about them though from your birth class, which I absolutely love. So I'm gonna stop. Yeah, so you do know that the risks and the benefits. With the forceps, there is an increased risk of tearing, and there is always an increased risk of some bruising on the baby's head, just because we're using the head to kind of help us pull the baby out. But remember that either if we use forceps or vacuum, you need to still be pushing too. A lot of people think the provider is going to do all the work, but that is not the case. We still need you to push. So I'm excited to get to pleat, and we'll start pushing. It's going to be soon.